Happy Tuesday. Welcome to another anatomy lesson. It's me again, Myra. This week we're going to talk about anatomy terms. Some anatomy terms, not every single thing in one lesson, but I want to go over a few that we're going to be using a little bit further on into our lessons, okay? So I just named this lesson Basic Medical Terms for Anatomy. Okay? Glad you're with us. And the whole premise of doing this lesson is because we'll have to compare the location of body parts relative to each other. So a shoulder versus the elbow, the head versus the chest, just for a couple examples, and we'll understand that more as we go on. But I didn't want to continue with the lessons without teaching some terms that we are most commonly used in anatomy, especially as you may remember or not remember, those that are new here. I am a 35-year, going on 35 almost, x-ray tech, CAT scan tech, MRI tech. So these I have used my whole career since 1986 when I started, okay? So the whole premise is to compare the location of body parts relative to each other. Anatomy uses some universal directional terms, and those are what we're going to be going over today. Okay, let's get started. The first term is anterior. Anterior. That means the front of the body. Anterior. Okay, everything from my ear over, or if you're talking about the front of the body, front of the face, front of the chest, abdomen, knee, that is anterior, okay? So opposite of anterior will be posterior, behind, okay? The definition is posterior is back of the body, toward the back, okay? So my nose would be anterior, but the back of my skull would be posterior, okay? Next would be ventral. Ventral is just another word for posterior, the back of the body. Then opposite of that would be dorsal, like a dorsal fin. Dorsal is only another name for anterior, the front, toward the front of the body, okay? Next one, distal, means away from the center, away from the trunk, okay? So distal. So my hips are distal from my chest. They're below. They're going this direction. They're going away from my trunk, my chest, my belly, the hips. I could say my knee, I could say my foot, anything that is below where I'm starting, my chest, my abdomen, whatever, that would be distal, okay? Opposite of distal, proximal. Proximal means toward the center of the body, okay? So my shoulder is proximal from my elbow. So this is my elbow, this is my shoulder. So the shoulder is proximal to the elbow. It's up, going up, okay? Proximal, toward the center of the body. Medial, if you was to cut me in half, medial, so it means toward the center. this direction, toward the midline. This would be my midline. If you cut me in half this way and two parts this way, this would be midline, okay? This is midline. My chin is midline. My notch, we talked about that last week, is midline, okay? So my clavicles here are in the midline. My shoulders are not midline, okay? Lateral, so if medial is toward the midline, we have to have an opposite. Lateral is a side away from the midline, okay? So, example, this is the midline. My shoulders are lateral from my breastbone. Here's my breastbone. Here's my part of my clavicles. This is going to be medial. Out this way is lateral, toward the sides, okay? Toward the sides, lateral, away from midline, away from midline. Next, internal. Internal means inside or close to the center of an organ or cavity. Okay, we had different cavities. We'll go over that in a little bit. So internal, okay? External, furthest away from the center of an organ or a cavity, okay? So my liver's on the right upper side, okay? It is external, okay, from something that's in the midline, okay? External, internal. When we look at your shoulders on x-ray, we do what's called an internal and an external rotation. We're looking at the head of the humerus, amongst other things. We have to get two different views. So we do an internal, this is my arm, internal and external rotation to see different structures in the shoulder, okay? Internal, toward, external, out, okay? Next, I'm going to carry on here. Wrote them down so I wouldn't forget to tell you all about them. Frontal. We have frontal. That means the front of the body, okay? It's anterior, but frontal, this is the front, okay? Occipital, we talked about the occipital bone, the occipital lobe in the last first two lessons. Occipital, back of the head. Now this next one we don't use very much, but we include it in case you ever hear it. It's called rostral, R-O-S-T-R-A-L. And what that means is the front of the face. We hardly ever use that term. Rostral, front of the face. But I wanted to make you aware that it is a medical term. It is a direction. Front of the face, also known as rostral. Very, very rarely used, okay? Next, caudal. If you've ever had an injection, sometimes they do caudal injections in the lower back toward your tailbone. Caudal injection is what it means. Toward the tailbone or away from the head end of the body. Caudal, toward, down, caudal, okay? Cephalic. Cephalic is toward the head. In x-ray, we have to angle the x-ray tube to open structures up or to see structures better. So pretend like I'm holding my x-ray tube, the thing that, the table is down here. You have the x-ray tube. We can angle it. Cephalic toward the head, caudal toward the feet, okay? For knees, anything. If you want to open something up, different positions, we can twist the X-ray tube, caudal toward the feet. So your head is down this way, cephalic toward the head, or caudal toward the feet. Okay? So it's caudal and cephalic. Superficial. Most people probably already know what superficial means, but just in case you don't, superficial means it's closest to the skin. Closest to the skin. Superficial. Have a superficial cut. My veins look really superficial. See how they're popping up? Superficial. Okay? Right next to the skin. Superficial. On the other opposite end of that, deep. Deep, like deep water. Deep. Away from the body surface. A deep wound. You have a deep cut. Got to have stitches. Sometimes it goes, to the muscle. Sometimes it goes to the bone, depending on the laceration, the cut. Deep wounds penetrate far below the skin. Okay, that would be a deep laceration, a deep cut, deep. So we have superficial, close to the skin, or we have deep, okay? Which is not, it's deeper into the body, okay? Central, it is what it sounds like, central, center of the body, central, okay? Peripheral, away from the center, peripheral. Here's one of my favorites, ipsilateral. Ipsilateral means on the same side of the body. So my left shoulder, remember it's opposite, I'm looking at you. This would be my left. This would be my right, okay? So ipsilateral on the same side. So my shoulder and my kidney are ipsilateral on the left, okay? Ipsilateral, same side. Bilateral, bi meaning two, both sides, affecting both sides. So say you were having numbness in your hands, carpal tunnel. Just for example, I'm not a doctor, but I see this every day. Bilateral hand numbness. Bilateral numbness in the fingers, in the palms. Okay, bilateral means both. Both hands are tingling. Both hands are weak. Both hands are possibly fractured. Bilateral feet, bilateral knees, bilateral, okay? Both sides, okay? Superior in medical terms means higher than another, okay? My forehead is superior to my chin. It's higher, okay? Coronal plane, the body in radiology, in medical, I guess not just radiology, but medical, we've named 3 planes in the body. Planes, not planes, airplanes, planes of the body. They're coronal, they're sagittal, and they're axial. 3 planes. And we use those, location of the body, way to look at the body. That's what we use, especially in cross-section anatomy like CT and MRI. We use coronal plane, axial plane, and sagittal plane. Coronal plane separates front and back. So remember a while ago I said if this is midline, if you was to cut me in half from left and right, what coronal does, it cuts me in half this direction, separates the front of me from the back of me. Okay, so you would cut me this way. I can turn around, you might could see. If you cut me this direction, you would separate my chest from my back. That is called coronal plane. Next, sagittal plane. Sagittal plane divides me in left and right sides. Okay, so once again, this is midline, okay? But if you cut me this way, you're cutting me sagittal, okay? Right and left, okay? Last one, axial. That would cut me from top to bottom, okay? So, say my belly button up, my belly button down, that would be axial plane. And what we do in MRI and CT is cross-section anatomy, and we don't physically cut you in these directions, these planes, but we actually can see as if your body is a loaf of bread, so to speak, and we take and we look at each and we do slices, not literally, but figuratively, with the machinery, with the scanners. We can look at the top of your brain, say your whole entire brain, look at your brain top to bottom, side to side, and front to back. 3 planes we use, and we look at each individual slice to look for fractures, head bleeds, tumors, any kind of abnormality, vessels that aren't right, muscles that are torn, things like that. In your spine, we're looking for pinched nerves, disc bulges, things of that nature. So we use those 3 planes to look at your body as in like in a 3D images. So axial, top to bottom, sagittal, side to side, coronal, front to back or back to front. Okay, can go either direction. Okay, so far so good. So we talked about axial plane, top to bottom, sagittal, side to side, coronal, front to back or back to front. Okay, we can go either direction. We can go from top of your head down. We can go from your chin up or your whole body up. Feet first, all the way up that direction, or head down this direction, okay? Now, we talked about earlier, mid-sagittal plane. This is the midline. So that mid-sagittal plane, equal halves of right and left. This is the mid-sagittal plane, right dead in the middle. So I'm not off-centered, okay? If it's mid-sagittal plane, you have my entire left side, you have my entire right side, okay? Mid-sagittal plane. Some more that we're going to talk about. You might go to the hospital, doctor's office, imaging center, and they might tell you lay face up on the table. Tables are always cold and hard, but what they're telling you is they want you to lay supine. Supine means laying face up or laying on your back. Face up, supine, okay? Prone, opposite, on your stomach, face down. You want whatever you're looking at, especially x-ray, to be closest to where the film is. We don't really use film anymore, but the image intensifier, the camera for the lay person. So we have to have you in certain positions. So supine, face up, prone, face down on the table. We have a few, you lay on your left side. You can be standing also. You can face if you're having chest x-ray, you put your arms around the x-ray equipment. Technically, you're prone, even though you're standing up, but you're putting your chest against it, so you're prone. You put your back up against it, you'll be supine, okay? We tell you for a chest x-ray, put your left side against the machine. That's a left lateral. A lateral means the side, right? So we're trying to get a picture of your chest this way. Put your left side against, this is the x-ray, the Bucky or whatever. Raise your arms above your head. We're trying to get a left lateral. Very rare we do a right lateral for a chest x-ray, but it can happen, okay? So left lateral, left side. So if you're on the table, you're laying on your left side. X-ray tube is here. You're laying on your left side. You also can do the right side. Lay on your right side. Certain things you want to see on your right side, left side. It gives them a different view of what we're trying to look at, okay? Some things require a right lateral. Some things require a left lateral, okay? If you ever had your hand x-rayed, we'll put it flat on we'll say this is where the table is. You put your hand there, you can see. We'll put your hand there. We'll have you turn your hand a little bit. Then we'll have you turn it all the way on its side. This will be the film or the x-ray table or whatever. That would be a lateral, a side view of your hand. So an AP or a PA, anterior, posterior, supine, prone. May do another one on the side, okay? Right lateral, left lateral. The next is Fowler. It's mostly in surgery, but a Fowler is you want to have your head higher than your feet, okay? So if this is a gurney, a stretcher, okay? You should be your head, this is your head up here, your head should be higher than your feet, okay? It's mostly a term used in surgery, but just be aware that it's called a Fowler. So you want your head higher than your feet. So opposite of that is what we call Trendelenburg. Trendelenburg, your feet, this will be your feet. Your head's going to be lower. We use that sometimes in radiology for different things, Trendelenburg. If you've ever had a myelogram of your neck, your cervical spine, we put you Trendelenburg because they put the contrast in your back, but we have to move it to your spinal canal. We have to move it up to where your neck would be. Your head would be up here, okay? We got to get you Trendelenburg so that we can move the contrast from your back to up toward your head. We don't want it in your brain if we can help it, because it will give you like an ice cream headache. But we do want to get it in your cervical spine if that's what your doctor needs to see, okay? That's Fowler and Trendelenburg, okay? It also is used for abdominal surgery, lower abdominal surgery, and some gynecology procedures when you're Trendelenburg. Okay? All right. Doing great. We're almost done. Now, I wanted to show you just a few things really quick. We also, I have my phone here. I have to read it. I'm sorry. We also have different body cavities. Body cavities. At some point, we're going to be talking about the actual organs themselves. So I want you to get familiar with where these organs, systems, what have you, live. Body cavities. The cavities or spaces of the body contain internal organs or viscera. The two main cavities are called the ventral and dorsal. Now remember, if we go back to our words again, what was ventral and dorsal? We talked about it just a few minutes ago. I'll bring it back up again. Ventral, another name for posterior in the back. So we have ventral and dorsal. Dorsal, once again, another name for anterior, the front. Okay? So that's why I want to bring it to your attention. We have body cavities, dorsal and ventral. Okay? The ventral is the largest cavity and is subdivided into two parts. Thoracic, being your chest, and abdominal pelvic cavities. Okay? Abdomen, pelvis. Okay? So we have thoracic, chest area, abdominal, and pelvic. Okay? Now, the diaphragm is part of the thoracic and abdominal. Okay, your diaphragm is between your lungs and your stomach and your abdominal. I shouldn't say stomach, but I don't mean stomach proper. I mean the whole thing. Okay, a dome-shaped respiratory muscle. Okay, diaphragm. When you take a deep breath, your diaphragms go down. Okay, they push to allow more air into your lungs. Your diaphragms go down. When you let your breath out, your diaphragm comes back up. Okay? So the abdominal and pelvic cavity, the lower part of the ventral cavity can be further divided into two portions, abdominal portion and pelvic portion. Okay? Abdominal and pelvic. All right? The abdominal cavity contains most of the gastrointestinal tract, your colon, small intestine, stomach. Now I mean just your stomach, not the whole thing. Your stomach, where your food goes, okay? Your stomach, as well as the kidneys and adrenal glands, okay? The adrenal glands live just above your kidneys. And for those that are in X-ray, or have been in X-ray like me, my instructor always told me that how to remember the adrenal glands. They were like hats for the kidneys. I miss you, Edna. So the adrenal glands were hats for the kidneys. They live right on top of the kidneys, adrenal glands. Okay? The abdominal cavity is bound cranially by the diaphragm, laterally by the body wall, and caudally by the pelvic cavity. Okay? The pelvic cavity contains most of the urogenital system, so your bladder, okay? Your reproductive organs, those are in the pelvis, the pelvic cavity, okay? Pelvic cavity. The pelvic cavity, once again, urogenital system as well as the rectum, okay? Everybody knows that. Well, most everyone knows that. Not everybody should maybe not know that, but the rectum, that is in the pelvic cavity, okay? Pelvic cavity. The pelvic cavity, once again, contains the urogenital system as well as the rectum. The pelvic cavity is bonded cranially, so high, by the abdominal cavity, dorsally by the sacrum, okay, and laterally by the pelvis, okay. Dorsal cavity is the smaller of the two main. As its name implies, it contains organs lying more posterior toward the back of the body, okay? Divides in two portions. The upper, or the cranial cavity, houses the brain. The lower, or vertebral canal, houses the spinal cord. So your brain is posterior, it's dorsal. So your brain and your spinal cord are separate from your face, your chest, your abdomen. It's totally separate, okay? Totally separate. But I wanted to bring that to your attention as well, okay? We've covered quite a bit tonight. I know we're already past our 30-minute mark, but I hope that you have learned something from this. I do have two diagrams before we go that I wanted to show you that might help you a little bit. In medicine, in anatomy, we use what's called the anatomical position. And what that is, I'm going to show you right here. Anatomical position, you will have, it's like you're facing us. Your arms will be out, not down by your side. Your palms would be up, and your feet are straight. Okay? So anatomical position, right there. Now keeping that in mind, this is the ventral, okay? Front or forward towards the front. I'm sorry, it's backwards, but this is anterior or ventral, front or towards the front. Anterior, arrow is going toward the front, okay? This one, dorsal or posterior, back or towards the back, okay? Towards the back, towards the rear of the body, okay? Posterior, dorsal, anterior, ventral. They're still, see, we've turned him around now, okay? This is the back of the body. Front of the body, back of the body. This next one, cephalad, cephalic, towards up, okay? And exactly what it says, towards the head, toward the head. Cephalic, caudal, okay, towards the tail, okay, towards the tail. And what it says specifically, towards the tail, caudad, caudal, toward the tailbone, okay. Next one, superior, superior, above, going up, still in anatomical position, so they're facing us. Here, superior, inferior, below, superior, above, going up, inferior, going down, below, medial, there's that line again, there's the line, going toward the midline, medial, midline again, lateral, going out toward the shoulders, okay, away from the middle, Okay? Away from the midline, from the middle, right there. Okay? Almost done. Proximal, near the center of the body. Proximal. Still anatomically positioned toward going up. Okay? Distal, away from the center of the body. Okay? So your knee is distal from your shoulder. Your shoulder is proximal from your knee. Okay? Here's two more. These are a little bit different. You have a radial on the thumb side, a radius and ulna. We're going to go over those eventually. The bones of the hand, wrist, elbow, and shoulder. Radial side, thumb side. Okay, thumb side, radial. Ulnar, pinky side. Radial side, ulna side. Okay? Foot, a little bit different. Okay? The top side of the foot is dorsal. Okay? This would be dorsal. Okay? Anatomical position, dorsal. Okay? Plantar, how I remember this is you plant your foot. You plant your foot down. That's the plantar surface. That's where your heel is, the bottom of your foot. That's the plantar surface. Okay? And what it says is underside of the foot. Underside of the foot is the plantar surface. Dorsal is the top. Okay? So there's those. Last one I'm going to show you is the planes. Just a little quick short version of the planes. So sagittal plane. Here, you're cutting me in half. Coronal, you're going from front to back. Posterior again, same thing. Anterior, this is the front. See, he's in anatomical position with his hands out, stretched out like this. Axial, you're cutting him from top to bottom. That's axial or transaxial, some call it. Superior, going up. Inferior, down. Okay? Arrows going down. Superior is going up. So I hope this helps. And I will see you again next Tuesday. For now, hope you enjoyed the lesson. Go back and re-watch it if you need to. Hope it's helped you a lot. I'll talk to you next week. Have a good night. Bye-bye.